was interesting because when we were talking to Jamison, she said, yeah, in bipolar disease, yeah, there is a prevention. You take the medication, you do your cognitive behavioral therapy, but actually you have to touch somehow rock bottom to go back to the point to really wanting to treat it. That was something, and I thought, okay, this is the difference because we can really prevent the patients coming to the point of getting ICD.
Yes. Yeah, that's another good point that it's occurred to me in the past, but not until you just mentioned this now, is that I think another difference with bipolar disorder and what we're talking about, and this is where I struggle, I think, with a neurologist more than any other place, is that as psychiatrists, we're used to having to set firm limits with patients. We're used to doing things that a patient may not like, or taking control of or trying to take control of a situation and not deferring to the patient. It's just the nature of psychiatry, because we're used to people having maybe not being truthful with us, or violating limits that we feel like we need to set. I think neurologists by nature, in a good way, just want to be helpful to the patient. If a patient reports any neurological symptom, a tremor, stiffness, slowness, their inclination is to just increase the medication or add a medication because they think that may be helpful. And I've talked to neurologists before where this problem exists, let's say an impulse control disorder, and the neurologist will say, well, there's just nothing I can do about it. The patient says they need this medication. And I said, well, no, you're the one who's ultimately responsible for prescribing it, and it's your job, in my mind, to weigh the risk and benefits of the medication. And if the risks are such that it's outweighing the benefit, it's not like the right of the patient to be on this medication. It's your decision, and you have to do what you think is in the best interest of the patient overall. And so sometimes I feel like that comes easier to a psychiatrist based on our background, where we're used to dealing with very difficult situations and very difficult patients, than it comes to a neurologist in some ways.